I had a ruptured disc and herniated disc. I had crawled into the emergency room on my hands and knees.
When I first got it, it was a sharp, really burning sensation.
Unrelenting pain. It feels as though you're being stabbed in the back and there's just no relief.
Back pain is one of the most common medical problems in the world. It's the leading cause of disability in patients under 45 and one of the top reasons people see a doctor.
In a lifetime, up to 80% of people will experience an episode of acute back pain that is severe enough that they'll seek medical attention. That doesn't mean that we're all doomed. It just means that it's very common. We walk upright and our spines absorb a lot of weight and carry a lot of load. And so the low back is under high stress.
Despite that high stress, Dr. John Keel, medical director at the Spine Center at Beth Israel Deaconess Medical Center, says most back pain is usually temporary and will actually go away without any treatment at all.
In fact, 90% will get better within 3 months. Even within the first few weeks, the majority of low back pain episodes will go away on their own.
For those that don't, pain management through medications and injections or physical therapy can help. For most back pain, staying active, including staying at work, is key.
Bed rest is definitely an outdated prescription. This is one of the most important pieces of information that we've obtained from our space program, for example, is lack of activity or lack of stress to the body leads to deconditioning of multiple organ systems.
But the experts say there are signs or red flags that back pain could be serious. Those include fever, unexplained weight loss, recent trauma, weakness or numbness, severe pain, bowel and bladder dysfunction, or a history of cancer. Neurosurgeon Dr. Michael Groff says major problems are rare and that in fact only about 1% of patients with back pain will require surgery.
There's no back pain so severe that it can't be made worse with surgery. And so we often have to keep in mind that simply because every other modality that we know of has been tried, that doesn't automatically mean that surgery is a good idea.
And unfortunately, that abnormal movement can cause the back pain that you describe.
And we try to be very, very critical of ourselves and only offer surgery to people when it really stands a chance to benefit them.
The good news is that imaging and surgical techniques are more advanced than ever before. For some fusion surgeries, for example, doctors at Beth Israel Deaconess use a technique involving a tubular retractor, a tiny tube that splits muscle fibers apart to give the surgeon access to the problem area without cutting or stripping away tissue.
We're very fortunate to have access to minimally invasive techniques that now allow us to accomplish the same surgical goals, but with much less of the attendant morbidity and problems that can sometimes occur with an operation. That ends up making the recovery time less, and it also decreases the amount of time that these patients spend in the hospital and the amount of narcotics that they require as they get back on their feet again.
The bottom line, doctors know more about diagnosing and treating spine problems than ever before.
I mean, that's like right on the end plate almost.
For patients that are experiencing an acute episode of back pain, they're not alone. The good news is that most acute episodes go away on their own within just a few weeks without treatment. In fact, it's very uncommon to require surgery, even for these severe episodes of back pain.